I've been a GP here for 5 years, and I work part-time here and part-time at King's College University, where I teach students and do research projects. So I'm a GP here in the practice, and we have a number of different GPs and we have interest areas. My interest area is in respiratory medicine, so I look after and help supervise the care of patients with chronic lung disease. That includes asthma and COPD. And then each doctors have an interest area. So really we're part of a team, and we have the GPs who are maybe heading that team, but we also have nurses, nurse practitioners, healthcare assistants and a pharmacist who can help deliver care for patients. We as GPs will see patients and we can make new diagnoses, or we can manage complex conditions such as heart disease, lung disease. So we have a unique service available in the East End, which is social prescribing, where if I do have someone who's having issues around their benefits, around their housing, maybe that's contributing to their mental health problems or contributing to their chronic diseases, I can refer them to social prescribing at the Bromley by Bow Centre, and I have some fantastic feedback from those referrals, and that's been really helpful for some of my patients.
Hello, my name's Linda Aldous. I'm Director of Nursing at the Bromley by Bow Health Partnership, and it's my job to help support and advise our nurses and healthcare assistants with the most effective and safe care for our patients. The nurses and healthcare assistants offer a whole range of services to our patients. Our healthcare assistants can offer patients NHS health checks, check their blood pressure, take their blood tests when needed. The nurses can offer a wide range of services, such as giving your baby injections, giving people advice about travel health, caring for wounds and post-operative care, and then more complex care, such as looking after people with diabetes, asthma and other respiratory conditions. As a nurse, it's really important that we look after our patients with care and compassion. So when you come and see our nurses, you should get the very best care and really feel at the end of your consultation that you've been listened to, your problem's been shared with and then dealt with in a really kind and thoughtful manner.
Hi, I'm Lubna. I'm a healthcare assistant at Bromley by Bow Health Centre. Here I do blood tests, blood pressure checks, give healthy living advice, do diabetes checks, hypertension checks. We're here really to assist the clinical team. When they have long-term health conditions, they're in and out of surgery quite a few times a year, and majority of the checks are done with healthcare assistants. So in terms of seeing them and making sure that they're getting the right service is quite important. So I always try my best, always give 100% when seeing patients.
Hi, my name's Emdad. I'm the practice pharmacist for XX Place. My role here, I do medication reviews on patients that when the prescription shows the medication review is overdue, I check for if the medicine is clinically appropriate, if the medicines are all synced together, any concerns you have about your medication, side effects, and making sure everything is within regime. So as a pharmacist, I want to make sure that overall the patient will improve the health outcomes. If there are misconceptions about medications where someone might not be taking all of them, for that to be communicated to me, and we could find a way around better medicines taking, or if there are issues around the medicines that's really affecting them, we could look for alternatives and sit down and generally have a good discussion about medicines and overall physical health and mental well-being. The other roles as well I can do as a pharmacist as well is minor ailments, so conditions such as hay fever, headaches, migraines. We can deal with them. You don't always necessarily have to book a GP appointment. I'm readily available throughout the week, and so you also can book an appointment with them. Also, if you've joined us from another surgery and you need medication, we can look into transferring records and making the whole process easier and smoother for you.
Hi, I'm Fatima Udin. I'm a health advocate. I've been here working over 10 years. I mediate between health professionals and patients, and I run walking group. I have a breakfast club as well with our patients. We call it Grandma's Club. It's a fantastic group. Women come in to socialise, enjoy, communicate. Patients who are lonely and they have difficulty going out on their own, they live on their own, they don't have a lot of family surrounding them, they come to enjoy themselves basically. We have healthy picnic, we go away in little trips and make patients feel better, enjoy. The things are important to me as a health advocate. The advocacy service I provide is, I know sometimes everybody thinks it's interpreting. Interpreter is saying what a patient is saying, you repeat that. But advocacy is you've been somebody else's voice and you're trying to support them, mediate them. You're trying to say what they really want to say from their inside. So you are being that person. So my role is, my job is, my responsibility is to understand the patient and explain everything in details to the doctor or the nurse, and explain it back to the patient the same way, and make sure the patient understand the health condition and what they are here for. We can work together. That's why I've got these groups and these projects which help our patients come and engage, and patients can get together and recognise other remedies, what they would like to do to manage their own health care.
My name is Mustafa Al-Ahmed and I'm a patient assistant here at St. Andrew's Surgery. I am the bridge between the patient and the surgery. We try to provide as much care for the patients as we can. Working in this role at St. Andrew's makes me feel appreciated.
So I work alongside the whole of the organisation to look at the ways we can continue to deliver health services to the patients in our community. One of the best things about this organisation is we value the welfare of our staff and our patients, and we look at ways we can grow. For example, myself, I started off as a receptionist and I grew into becoming a finance manager, and it was in a very short span of time. I believe, just the way we do this with our staff members, we can do that with our patients, and we live in such a diverse community, so we have to look at ways we can continue to deliver the services in a viable way.